Good morning. We are at the SOUKYA International Holistic Healing Center in Whitefield, Bangalore. We are here to talk to Dr. Raghuveer, who is a specialist in naturopathy. We'll also be talking about acupuncture and diet. But let's start with naturopathy first. Okay. Good morning, doctor.
Morning.
Please start us by telling what is naturopathy, because when we go to the internet and look at Wikipedia, it's very unflattering and it's even called pseudoscience. But we still see a lot of people following naturopathy in India and other parts of the world. So give us a very brief intro on what naturopathy and how it works.
Naturopathy or nature cure is the same word. Treating with the help of Pancha Mahabhutas like earth, water, air, ether, with using the traditional therapies with a modern science. We treat the person as a whole, body, mind, spirit and soul.
So how is it different from other alternative practices, like traditional practices like Ayurveda or?
Yes.
It sounds very similar to Ayurveda.
Yes. It's a drugless therapy. We won't use any drugs in naturopathy.
No drugs at all?
No drugs at all.
Not even Ayurvedic drugs?
Not even Ayurvedic drugs. We treat with the help of basic elements, natural, available like mud, water, fire. With that we treat the patient so that body can heal faster.
Okay.
That's why we say nature heals, physician treats.
So somebody actually goes to a doctor saying that I have this ailment, and does he choose naturopathy, or the doctor decides, okay, for him or her this is the best way to treat the ailment? Or
sometimes patient may not be knowing what is naturopathy, what is yoga. So we need to educate, as a qualified doctor, we need to educate which is best for him.
Okay.
Depending on his medical history, age, sex.
So how prevalent is naturopathy in India and worldwide? Can you give us some statistics, or is it a completely fringe method?
Yes. Nowadays, naturopathy and yoga is becoming more and more popular because of its natural effect on the body. People are accepting the nature cure, different therapies, natural methodologies, and they are feeling better with different natural treatments, and they are healing faster with less side effects.
Is there an inherent bias against naturopathy, particularly from the western part of the world, where the West sees it as some kind of mumbo jumbo, mud pack and all the stuff, and it doesn't really work for serious ailments and acute diseases?
No, definitely it works, but that's why first patient should go to the qualified person and tell the medical history. Then we take a detailed history and decide what is better. Maybe a mud, maybe a water, maybe a diet, or combination of all three will work wonder. If they go to the quacks, then they may be misleading to the patient.
Correct. So are there specific ailments or diseases, whether acute or otherwise, for which naturopathy works, and certain things where naturopathy doesn't really go there, if other alternatives are looked at?
Most of the cases, chronic cases, we treat very well with nature cure.
Like example?
Like arthritis, joint pains, rheumatoid arthritis, high blood pressure, diabetes. These are all chronic diseases where we can treat very well with a nature cure, with the help of natural treatments. Whereas acute conditions, we suggest to go to allopathy. All acute conditions, allopathy should handle it.
Okay. Can you, for the sake of the audience, can you tell us what is the difference between a chronic illness and an acute illness, the disease?
The chronic illnesses is like suffering from many years, diabetes from 20 years, rheumatoid arthritis from 10 years. These are all chronic diseases.
What we generally look as lifestyle diseases are all chronic diseases?
Yes.
Okay.
All lifestyle changes, lifestyle diseases are chronic diseases. We need to tackle from the basic treatment. And taking a complete health history, we know from when he is suffering, what he is suffering, what is the intensity of the disease. Based on that, we do the treatment, we decide the treatment, and we give a specific diet for them. And as I said, nature is a great healer. With using natural remedies, we definitely treat better.
Okay. But most generic disorders like diabetes or whatever you want to call it, or blood pressure, they all come under chronic illness?
Yes, yes. Depending on the years of suffering, age of the patient, and with that, we will understand from the patients by taking deep, detailed history, and we decide the treatment and diet modalities.
So when a patient walks in with a chronic illness, let's say high blood pressure
Yes.
or whatever, what are the usual readings you take apart from BP reading? What else do you blood test karna padega? Matlab, what else do you do? Is there a detailed report you get?
Yeah, first we take a detailed history.
What is there in the history?
History like name, age, sex, and what is his lifestyle, the type of work, whether stressful work or normal work, and what is his diet history, and overall life history we take it.
Okay.
And any medications he is taking, apart from the high blood pressure, any other diseases he is suffering, whether obesity is again associated with many other health issues. So in all angles we take a history, and then we'll come to a conclusion that this is a specific treatment for him for how many days and what is the treatment modalities, and we explain the guest how many days he should stay and take treatments and diet, and every part we explain that.
So when a patient decides to go for naturopathy treatment,
Yes.
At no point nothing invasive or drug related happens.
Yes.
Everything from the beginning till the end, till the cure part is completely natural.
Yes, natural treatments and yoga, breathing exercises, diet, and staying with the nature itself is a great treatment. That's why we say nature heals. Nature is a great healer.
Is there a criteria for people who can adopt? For example, you said chronic diseases we can handle, but not acute diseases.
Yes.
For example, you can't cure cancer with naturopathy. Can I say that?
We can help. We cannot cure. We won't use anywhere cure.
Okay.
We can help with a better lifestyle. Like changing the diet and teaching some simple breathing techniques and meditation which relaxes his mind, which is very important in cancer.
Yeah, absolutely. Particularly after the treatment.
Yes,
recovery
yes.
part is very important.
And they'll be undergoing a lot of medications, chemotherapy. The side effect of that is too much.
Intensity.
To reduce the intensity of the side effect, our treatment will definitely helpful.
So how long have you been practicing naturopathy?
Since 30 years I am practicing naturopathy.
30 years?
Yes.
Wow. From the beginning you have been a naturopathy specialist?
Yes, we have a 5 years degree course, Bachelor of Naturopathy and Yogic Science in Ujire near Mangalore. Is a 5 years degree course. Followed by I have done my specialization in acupuncture and reflexology, in MD in acupuncture and reflexology.
So it seems very unfair to me that somebody who has studied naturopathy has gone through the same rigmarole of 5 years, like a MBBS or
Yes.
any doctor
Yes.
or allopathic doctor, but still somehow this is looked upon as an alternative or
Yes.
second option kind of a thing.
Yes.
Why do you think that is? It's a people's mental.
It's a lack of knowledge. People don't know what is naturopathy, lack of knowledge. They think doctors means allopathy, treatment means allopathy.
You have to cut open people.
That people should understand where we are standing, what is importance, and that's how the education is important in this.
Okay.
Many people may not be knowing. When we studied, when I joined naturopathy, even we also not very aware of what is naturopathy. So now compared to 20 years, now much better. People are aware of holistic system, nature cure, yoga. People are going for that and opting treatment for that and getting benefited.
I'm sure it was also very helpful in helping people with addiction problems.
Yes, all addictions like smoking, tobacco, alcohol, it works wonder in that, all addictions.
So it is up to the patient and the caregivers to decide where do you bring naturopathy and where try something else.
Yes, that's why the qualified doctor is required to educate the people what is better, what is best for them based on their illnesses. That is a lacking in the population.
Okay, okay. So now we'll briefly talk about how SOUKYA uses naturopathy. You must be getting all kind of patients and
Yes.
people.
So SOUKYA is a holistic health center. We practice nature cure, Ayurveda, homeopathy. So when they come, we educate the patient what is the best in our system. We tell the patient to take it. Maybe in Ayurveda, Ayurvedic doctors will explain their perspectives. As a naturopathist, we suggest what is best for him. Maybe a water therapy or yoga or diet. Everything we educate them. From the homeopathic side, they educate the patient medications and everything. So it blends well with other systems of medicines.
Okay. So it can be as a supplement to the other.
Yes, we can do it separately or blending with other systems. Anything is fine.
Even English or allopathic,
Yes.
treatments also can go.
Definitely.
So naturopathy is not necessarily something you get in the resorts. It's a very serious medical practice and way of healing people.
Yes, it's a
Because they say mud pack and water healing and all the stuff. We look at glossy magazines with all the nice pictures and the people relaxing.
Yes.
But it is much more than that.
Much more than that, and what you have seen is maybe in the spas.
Exactly.
More of beauty treatments. More of relaxation and beauty treatments, but same way we have a treatment for a serious medical illness. People should understand that.
I think in this conversation, that is the most important message I have to go out, saying that naturopathy is a very serious stream of health science.
Yes.
And it has been, our Dr. Raghuveer himself has been practicing 30 years, he's been there for years. How old is naturopathy?
It's a very old system.
Does it have a date, starting point?
There is no specific date for that, but thousands of years people are practicing.
Is it Indic?
Yes, Indian system of
Sure
medicine.
about that?
Yes.
It's not just Chinese and Indian.
No. It's a purely Indian system of medicines.
Where did it start from in India? Do you know that?
It started from different parts of the India, and then they accumulated the knowledge and started water therapy, mud therapy, and they do a lot of trial how mud works on our body, how water therapy helps in your treating the diseases. So like that they have started, and
okay. This is about how the government of India is promoting naturopathy through Ayush and even offering training in naturopathy, 5.5 year bachelor course, is it?
yes.
Could you tell us something about people who are interested in, people who want to follow your path and become healers using naturopathy?
Yes.
Could you tell them how to go about doing it?
So Government of India started the separate department for this, Ayush. That includes also yoga and naturopathy. So it's a 5 years degree course, Bachelor of Naturopathy and Yogic Science. Now most of the Indian state, it is colleges are coming affiliated to universities. It's a 5 years degree course where in the first 2 years we have to study anatomy, physiology, dead body dissections, everything.
Really?
Like social and preventive medicine, microbiology, everything we have to study.
Naturopathy students have to dissect dead body.
Yes, we
They
did.
have to go through the same thing.
Yes, like how allopathy students will study. First, we should understand how the cells, organs, bones are situated in the body and how the bodies are functioning. Then next 2 years, they go for allopathic studies. We come for naturopathic medicines.
So only after second year the branch happens.
Yes.
Foundation is exactly, anatomy is exactly
Same thing like allopathy.
Okay. Even though naturopath doctor might never open a patient, he still has to know what's going on inside.
Yes, definitely. Because as a physician, he should know how the organs are situated, how the cells are working, how the circulation is happening. He should have a thorough knowledge about human body, physiology, anatomy. One must know. Then only we can treat the patient.
So you're saying about this government 5.5 year program.
Yes.
After 2 years, what happens?
After second PUC, you have to take you can choose through CET also. You can get a seat in naturopathy. Then you have to study, and then
So you said
5 years.
first 2 years you
Yes.
look at the body.
So second 2 years is all naturopathic treatment like philosophy of nature cure. We have a yoga, diet, food and nutrition. All the systems, our systems will start there.
Okay. And in your experience, naturopath has worked best for which specific ailments? Can you name 5 or 6 ailments, acute ailments which are...
All psychosomatic. Nowadays we say psychosomatic. Psycho means mind, somatic means body. So we treat most of the psychosomatic diseases where people are suffering. 90% people are suffering from psychosomatic stressful conditions. Because of the stress, they develop hypertension, blood sugar level fluctuations, ulcers, acidity, joint pains, arthritis, or any the diseases start slowly and go to the different level. So we are very, very confident with a nature cure and yoga we can treat most of the cases, and we can heal naturally without any side effects.
And last question, once a patient is treated with naturopathy, let's say I have an arthritis or
Yes,
problem,
yes.
It is a permanent cure, but they have to continue the specific lifestyle after that.
See, coming to the hospital, taking doctor's advice, taking treatment is the first part. After that, once they go back, follow-up is also equally important, because how long they can stay in hospital?
Correct.
Maybe 10 days, 15 days, 20 days. But after that, they need to follow certain rules and regulations which we give in the form of diet, what they should take, what they should avoid, what are the exercises they could do according to their illnesses, and what are the lifestyle they should change it. All the details we give, and they need to follow up. At least in the entire 24 hours, 1 hour they should spend for their body. That is very, very crucial.
Absolutely. Okay. So we have come to the end of the conversation, Dr. Raghuveer at SOUKYA about naturopathy, which is now we know that it's a very serious and a very effective alternative treatment for a lot of chronic ailments.
Yes.
We heard him say that he's gone through the 5.5 years of rigmarole of studying all this. He's been practicing for the last 30 years. I hope people ultimately understand the value of naturopathy and come back and look at the Indic or even the Indian style of treating certain chronic diseases at least. Thank you so much for your time and the gyan you gave us on.
Thank you.